Okay, hi, I'm Dr. Ben Barton again in Columbia, South Carolina. So the question now is, how long is it going to take to get better, and will this disc herniation relapse? So let's assume you've already been diagnosed with a disc herniation, you have the positive MRI findings, the exam, and you've had a professional tell you this is a disc herniation causing your problems. Now, if you decide to go through decompression therapy, what you can count on is about 20 to 25 visits to take care of the disc problem. It just takes some time to rehab these structures, the muscles, the ligaments, the tendons, and also the disc itself does not heal up overnight. And typically what we find is patients, it just takes them a while before they can rehab that disc and get it stretched back out and get it to come off of the spinal cord and get the pain to go away. So the research shows it's about 20 to 25 visits. Some may be a little bit shorter. Some patients may be a little bit longer. It just depends on the severity of the injury and how long that injury has been there in the neck or in the lower back. Now, the next thing we want to go over and talk about is I want to show you a model of the disc and explain how that works. Because what we're looking at is with the disc, it's in between the vertebrae, and what we're trying to accomplish with the treatments is we're trying to pull it apart so that instead of it smashing up against the spinal cord or hitting one of the nerves, which is what causes the pain, if we can go ahead and distract it and decompress it, it's almost like, if you can imagine a balloon, if someone's squeezing the end of a balloon, well, imagine what the balloon's doing. If we can decompress that disc, it's the same thing as letting that balloon go, so it will come back off of the spinal cord, and we can milk that disc back and forth with decompression, which will stretch it out and rehydrate it with some of the water and some of the nutrients that we need. So you just can't fix a disc lesion in a week. It just doesn't happen that way, and that's why it takes a little bit of time to rehab it. Now, the question is, will it relapse, which is obviously a question most patients have. Fair question, and the truth is about 10% of all disc herniations will relapse over the course of a patient's lifetime, but it's really dependent upon a couple of factors. And really the most important factor, quite frankly, is how compliant is the patient. And what I mean by that is, assuming we have fixed the disc problem and we are now in a situation where the patient is only coming in maybe every 6 months to once a year just to have their spines checked. Well, if you think about it, if you're doing the core strengthening exercises, if you're continuing to do the stretches and the rehab, and also if you are continuing an exercise program, you're going to be much better off than the patient who doesn't do those exercises and who gains a bunch of weight and things of that nature, which can have a very negative impact on the ability for that disc to stay healthy. And so really the relapse question is interesting, but what we also find is that even with patients who do have small little relapses, instead of having to go through a huge program again and having to go through 20 or 25 visits, typically what we find is after 1 or 2 visits the patient's symptoms dramatically decrease, and they typically, even when they do have a relapse, their pain levels are never as high as they were from the initial injury. And so that's the answer to that question about whether or not it will relapse, and also how long is it going to take.